Hey, Dr. C again. Today we're going to talk a little bit about something that, roughly 60% of us use as elders, and that is aspirin. Now, that's such a simple topic. You say, gee, in a minute you'll get through, get rid of that in a minute. Well, I think that a little bit about the history of it is very important, and a little bit about some of the effects of aspirin. And I'm going to tell you a little bit about some of the studies that have been done more recently on aspirin itself and what the results of those tests are. So let's get into it a little bit. Aspirin's been around for a long, long time. In fact, back in the older days, you might say, what they did is they used the willow tree bark. And you've seen a willow tree. There's weeping willows. There's different willow trees out there, but they use the bark. And what they would do originally was just have people chew the bark, and that would really be effective for fever, inflammation, and pain. Those three things. Because the ingredient in that willow bark, salicin, was very similar to aspirin itself. Not aspirin, but still the salicin did work against fever, inflammation, and pain. That's great. Even Hippocrates, good old Hippocrates. Remember, I took the Hippocratic Oath, like all the other doctors at the time. And he was using that. And he would have the people either chew the willow bark, or he would have them make a little tea out of it. And that eluded the salicin, and it did take the fever down, it did reduce the inflammation. And so that was part of the pharmacopoeia at the time. So it goes back quite a ways. Back in 1853, that's when Charles Gerhardt is his name. That's when he did finally identify the salicin, the salicylic acid in it. But it wasn't until the Spanish flu came around, which was 1918 basically, where aspirin really took off in the sales because there was nothing else out there to take the fevers down and reduce the inflammation. So people were using this salicylic acid preparation. So the flu really did expand the usage of aspirin, basically. But it wasn't until 1946 that acetaminophen, or Tylenol, came in. And for the same reason, to reduce fever, inflammation, and pain. And basically at the time, nobody really had pushed, you might say, the aspirin with a big campaign, basically. So now you had two things. And in 56, that's when the Bayer company took over, and the Bayer company then began mass producing acetyl salicylic acid, which is aspirin. And they used as an abbreviation ASA, acetyl salicylic acid. So, remember the acetaminophen now. The McNeil company took over that particular product back in 1955, and they also then began to market it as Tylenol. And both of these companies, both the Bayer company and McNeil, when that first came out, they would put the stuff out into little packets and give them out to the doctor's offices. They would give them out in the drugstores, little free packets of either aspirin or the Tylenol. And that was a good way of doing it because, let's face it, they were in competition then. So, back in 1971, finally, all these years, took until 1971 before they finally began to understand more about what aspirin does. So it isn't just an anti-inflammatory or anti-fever type of medication. It also is a bit of a blood thinner as well. And how did it work? Why did this antithrombotic effect begin to show itself? Well, they identified an enzyme that was responsible for creating or converting arachidonic acid into prostaglandins. So the important thing here is the prostaglandin. The prostaglandin is the thing that is responsible for blood clotting, and it's located on the blood platelets. That blood platelets are the component in your bloodstream that, along with red blood cells and white blood cells, it's the component that will allow you to clot. So if you get an injury, the blood platelets go to the site of injury and plug it up, basically. Well, in 1971, they discovered that aspirin itself has an effect on cyclooxygenase. Cyclooxygenase. And that was the thing that would prevent the blood platelets from plugging up the injury to the blood vessel. So it inhibited the production of the prostaglandin. Okay. So all of a sudden, cardiologists began using it. All of a sudden, aspirin had a resurgence and had a big population now using aspirin. What dosage was the best? Well, again, there's been a lot of papers over the years trying to identify what the maximum amount of aspirin you need in order to achieve that antithrombotic effect. And basically now we take, in the United States, 81 milligram aspirin. When I first started taking aspirin myself on a daily basis, all that was out there was 325 milligram or 500 milligram. So I was taking the 325 milligram for many years. I've been taking it for over 50 years now. When the very first article came out in the 1970s about that cyclooxygenase and the effect of aspirin. So basically now, people are arguing about, well, do you still need to take aspirin? All the studies that were originally done back in the 1970s and 80s, all were on males, younger males. So you can see, well, is it just as effective in women? Is it effective in the elderly? If it is there an age at which it no longer is effective? Can you give it to kids? So all these questions came up. And so they needed answers. So that's where a lot of the studies now over the last 10, 15 years or so have been trying to address those particular issues. Let's talk a little bit about some of the trials that have been done. Well, first of all, there is a trial called the cancer screening trial. Cancer screening trial. They had a large number of patients, 146,000 patients, some of whom were on aspirin, and they used roughly 100 milligrams of aspirin for their trial. And on the other half, because you always need to have a controlled group that only takes placebo, the non-drug. So it may be a sugar pill, whatever. So you've got half of the people on the sugar pill, half the people on 100 milligrams of aspirin. So what did they find out with that study? Well, they found out that there were less people dying from cardiovascular disease on aspirin than on the placebo. Okay, what other trials have there been? Well, there is a trial called the ARRIVE, A-R-R-I-V-E, the ARRIVE trial. They had 12,500 patients, but all of the patients were over 55. And again, one arm had people on 100 milligrams of aspirin, and then people on the sugar pill, about equal numbers. And they found out that people over 55 did benefit. But once you got over 70, that benefit seemed to decrease. So obviously they needed to have a little more study on the elderly. Also, just about at that time, they began to question the use of aspirin in kids because they had a number of kids who developed problems on the aspirin. And so now they have an age limit. Under a particular age of 5 or 6, you should not use aspirin. Use Tylenol or use ibuprofen. Okay. So what's another trial that they did? Well, they did the ASCEND, A-S-C-E-N-D trial. 15,500 patients. This time, these were all diabetics, over 40. And again, half of them took 100 milligrams of aspirin, half of them took the sugar pill. What did they find out? They found out that the people who took the aspirin had roughly about 8.5% of them had major cardiac events. And the people who took the placebo did not have that amount. They had 9.6%. So a little bit of difference in the amount of cardiovascular disease in there. And then finally, there was called the Aspirin, A-S-P-R-E-E trial, 19,100 patients. These were over 70. Now, remember, I told you about that age 70 didn't show the results as well as the people between 50 and 70. So they specifically looked at people over 70 in that trial. Again, 100 milligrams of aspirin and sugar pill. So basically, when you looked at both of those arms, they were pretty much the same number of people who had cardiac events. Same number. So then they looked a little more carefully at the elder population, and they found out that they were bleeding more. They bled more. Now, what about the women? Did they bleed more? The answer is yes. Yes, they did. And in fact, they did some studies now using men versus women and see if there was any specific difference in the two men and women. And they found out that the women had less problems with strokes, less problems. And they also had less problems with colon cancer, of all things, colon cancer. Now, there have been studies in the past that showed that people who took aspirin had a lower rate of colon cancer, a little lower rate of prostate cancer, a little lower rate of pancreatic cancer than people who did not. But they needed to get a larger study in order to make some sense of how this was, why this happened. How did aspirin, how can it affect colon cancer? Well, again, we went to the labs. See, how did aspirin work with colon cancer? Well, there were two things. It induced the cells in that cancer, induced them to die early. That's not a bad thing. It also inhibited the proliferation rate of the cancer. It grew much slower in people who were on the aspirin than who were not. So it seemed to be a good effect. And it seemed to be an effect that was noted both in male and in female, but much more so in females. So, as I told you about the women. They had less strokes and less colon cancer. How about the men? They had less deaths from cardiovascular disease, decreased number of heart attacks, and decreased colon cancer. So it seemed to be good, but in the males, there were a lot of people who bled. And so now you had a risk. You had people who did not get a lot of the heart disease or colon cancer, but an equal number who bled, GI bleeding, intestinal bleeding. So therefore, their recommendation then came out, both from the American Heart Association and from the American College of Cardiology. They recommended that don't just go and take the aspirin, get the advice from your physician individually. Don't just take it based on the results that you see. Okay. So knowing all that and knowing then how things work, what are our recommendations then? Well, first of all, we got to look at primary prevention and secondary prevention. What do I mean by that? Secondary prevention is if you've had either a heart attack or a major cardiovascular event. Will aspirin help to prevent a second major cardiovascular event? That's secondary prevention. And the answer is yes. And so people who have had a major cardiovascular event should be on a low dose of aspirin. Okay, that's number one. Number two, primary prevention. Will it prevent somebody who has never had a major cardiovascular event? Will it prevent them from having that first event? And that's where that risk of bleeding has to be weighed against the possibility of preventing that first major cardiovascular event. Now, if that were the end of the story, that would be it. Take somebody like me, for example, and I always go back to me because, let's face it, our experience kind of makes us go in that direction. I've been on it for 50 plus years. Should I suddenly stop it at age 80? Should I suddenly stop aspirin because of the possible risk of bleeding? I've never bled so far, 50 years, but should I stop aspirin? Well, they actually did a study now where they took people who had aspirin for many years, at least 10 years minimum, stopped it suddenly. And roughly, and I believe they did this in Sweden, I believe. Could have been in one of the other Scandinavian countries, but I do believe that it was Sweden, but nevertheless, they stopped the aspirin. 36% increased rate of major cardiovascular event. usually within several months. Not a good thing to just stop your aspirin. Not a good thing. I believe that somewhere in the past, I think it was probably Bill Clinton who stopped aspirin, well, on the recommendation of his physician, stopped aspirin and had a major cardiovascular event. So it can happen. It can happen. So you have to be very careful. Okay, what other reasons would we have for using aspirin? We said we use it to prevent cardiovascular events, especially if you've had one in the past. We said that it might lower the risk, too, of getting colon cancer. Both of those very legitimate, let's face it. So what else can it help with? Well, let's say that you've had a stent put in. Let's say that you've had a stent unrelated to the heart. Let's say that they put it into the femoral artery in the leg. They dilated it up, put a stent in. Should you be on aspirin? The answer is probably yes. But how long should you be on aspirin? Well, we're not 100% sure about the length of time you need to be on aspirin once you've started it. That is still an issue, and it's still being studied to see how long should you be on it. And once you've been on it for at least 10 years, how should you stop it if you've had a bleed? So obviously you shouldn't stop it cold turkey, but are there alternatives? Because the other things like Tylenol, ibuprofen, don't give you that effect like the aspirin does on the cyclooxygenase. Remember that. And they will abbreviate the cyclooxygenase. They call it COX. COX-1 and COX-2 is what they do. The COX-1 enzyme, the cyclooxygenase, does protect you because it inhibits that prostaglandin. Now, if you inhibit the COX-2 triggers the immune system itself. And so there are some COX-2 inhibitors out there, like Celebrex, for example, is a COX-2 inhibitor. They've taken a couple of COX-2 inhibitors off the market in the past as well. But at any rate, Celebrex is one that comes to mind. So the COX-1 inhibitor that we use now, the aspirin itself, is effective. No question, it is effective. So those are the things that are still being studied, and we're still going to get examples of aspirin again being studied, and I look forward to reading a lot of the stuff about it because it's very interesting that all these things, as they come out, add something to our knowledge about aspirin itself. Are there any side effects to aspirin besides the bleeding itself? Well, if you take too much aspirin, you can get tinnitus, a buzzing in your ears. That's usually a very good sign. You better back off on that aspirin. There are people who have had gastric ulcers, which is one of the reasons for bleeding, stomach ulcers. You may even get bleeding as a result of what we call liver failure and aspirin itself. So anybody who has liver failure or kidney failure probably should not be on the aspirin itself. Both of those are potential side effects of being on the aspirin. Okay. So at any rate, that is about all I have to say about aspirin. It's amazing how much you can say about one particular thing. And so it's had its ups and downs over the years. like I said, the two big stimulations to sell a lot of aspirin, first of all was the flu of 1917 and 18, and then the finding that it did act as a blood thinner, inhibiting that COX-1 enzyme, which then lowered the production of prostaglandin. And so those two big stimuli brought that Bayer aspirin stock right up. So very, very interesting history part. What we're going to talk about next time, I think we're going to talk a little bit about some of the common things that you eat. And the very first topic that we'll talk about most likely will be eggs. We'll talk a little bit about some of the other things, but eggs always seem to be in the literature, so and people are still studying it all the time. And we'll talk about that next time. So this is Dr. C, and I hope you have a nice day. Wear your jackets, get your flu shot, get your vaccine for the COVID, and have a nice day.